Thank you all so much. It's an honor to be here with so many of you who do so much work to help the people that we love and care for. I'm going to provide today a little bit of an overview of what's happening at the national level and across the states in our country. But first, and we'll move forward, I'd like to introduce myself and my organization, Inseparable. We're a national nonprofit mental health advocacy organization, and we're predicated simply on the belief that the health of our minds is inseparable from the health of our bodies. We work at both the federal level and across states. We're focused on improving access to care, expanding crisis response, and promoting prevention and early intervention. And one of the ways that we do this is by working very directly in states with in-state lobbyists. We work with partner organizations on the ground. We tap into both local and national experts and the power of lived experience. And this has actually allowed us to help pass 57 bills in 20 states over the past 30 years. Or past 3 years, I should say, sorry. And we do all of this to advance not only impactful policy, but really importantly, to help create a culture where mental health is always on the policy agenda and that we've developed the political power to drive it forward. And now, the federal landscape, as you all know, we just had an election. I am going to start by focusing on what's happened, though, in the past several years. Right now, there's really a persistent, I believe, cultural shift. There's widespread awareness and personal experiences of mental health and suicide prevention. In a post-COVID world and with the opioid crisis, we're now at a place where federal lawmakers, people working in federal agencies understand mental health at a different level than I've ever seen before. Furthermore, we have staffers in Congress that are of a different generation. They're of a generation that's grown up thinking and breathing mental health. And that actually gives me hope that that shift is something that isn't going to go away that readily. The other thing that we have is bipartisan support for mental health and suicide prevention. And one of the things that happened, for example, a few years ago in the Bipartisan Safer Communities Act, huge bipartisan support for spending significant investments in school mental health, in expanding the behavioral health workforce, including in schools, in pediatric telemental health, in 988 Lifeline and crisis continuum of care services. So there's been a huge investment across the aisle, and that is one thing that allows us to have a foundation to move positively forward on. I will mention, though, that with this election, we're now looking at likely Republican control of the White House, the Senate, and the House. Support for mental health and suicide prevention will remain, but I believe the form and the framing will shift significantly. There will be a focus on reducing spending in a lot of areas and in order to advance other federal priorities like securing the border. And I think one of the things that's important to look at is what the current House majority did in the fiscal year 25 budget, which hasn't passed. They stripped a lot of money out of the Department of Education to support school mental health professionals and instead proposed dollars to go to school safety, specifically hardening schools and training of school resource officers. We also saw in the House budget the stripping out of programs at the CDC for suicide prevention, for ACEs, for collecting data on firearm injuries. So that may be a harbinger of what is yet to come. The Senate will likely mitigate what happens on the House side, but there may be some challenges in the years ahead. And I think this is important for all of us to be aware of because federal funding does impact states. It impacts what's available. And now moving on to the state landscape. Mental health and suicide prevention remain bipartisan issues. But with this election, which didn't change the landscape in terms of control of state legislatures in a significant way, but there has been a shift in some legislatures further to the right, believe that this could have some ramifications for support for school mental health, for social emotional learning, for Medicaid. So there are a number of things that could shift as a result of the election changes. The other thing I want to point out is that to pass legislation, you actually have to have legislative leadership and the chairs of committees of jurisdiction who support your issues. Those leadership changes, those chairs are changing with this shift in legislative makeup. The other thing that I think is really important for us to think about contextually is that states are really looking at some significant revenue shortfalls. So federal COVID era supplemental funding streams are drawing to a close. States are spending down the last of those dollars. And at the federal front, we're no longer seeing the same kind of investments, I believe, that are going to flow to the states. We're also seeing states that are looking at budget shortfalls. For example, Colorado's looking at around $1 billion shortfall. That's going to create problems for people in terms of maintaining programs. There's also structural deficits. I won't get into that, but basically legislatures promising or enacting programs that revenue is insufficient to continue in forward-looking years. So basically, in summary, the state and federal landscape is looking to create some speed bumps for us in terms of the ability to pass mental health and suicide prevention legislation. At the same time, I think it's really important to look at all the positive progress that's been made in our country. And I want to touch on a couple Intermountain states because I think they're illustrative. So Utah, for example, is a state where we've just started to dabble in. There's actually been a lot of work in the state of Utah, and I won't touch on all these things. But Utah, for example, has passed legislation requiring parents to be educated about locking away firearms and medications after a student has been involved in an incident of bullying or some other kind of violent incident. There has been school screening support, school mental health education, the Safe UT app, mobile crisis teams and crisis stabilization centers, and workforce development programs. And I'll also point out Utah purchased a lot of trigger locks and provided financial incentives for people to buy biometric gun safes. So when you look at all that, you're really looking at a state that has actually made a lot of policy changes in support of youth mental health. And that's creating some momentum, or at least some hope, that we can continue some good motion forward. And specifically, when I look at what might be contributing to Utah's momentum, I think there's really a focus on shared values. See that has allowed the state to make progress on things like suicide prevention training for gun owners and for school mental health screenings. There are incredible public-private partnerships in the state of Utah. Kem Gardner Policy Institute, Huntsman Mental Health Institute, the University of Utah, all doing great work in partnership with the state. Some of the things I mentioned earlier are actually fairly low-cost initiatives, and I think that's one of the things that Utah has done well, is been creative about how they can advance policy in a way that hasn't taken significant investments of state dollars. There's also some legislative champions. Not a deep bench in Utah, but there are things here to work with. And now I'm going to turn to another Intermountain state. This is a state Inseparable has been more active in. And there's been a lot of legislation recently, all designed to help support youth, particularly in the school setting. One of the bills that I'm most excited about that Colorado passed is a bill that removes the requirement for a youth to have a formal mental health diagnosis in order to access Medicaid mental health services. They have the I Matter program, which provides free telemental health services, limited number, but still a way that gets students into therapy and getting connected to the care that they need. School mental health screenings, despite very vocal opposition in the state of Colorado. They have a Trails program. They're expanding capacity to serve youth with complex needs in state. A lot of things going on, especially also on the workforce development front. And when I look at Colorado, one of the things that excites me and makes me feel like there's very real momentum here is there's a growing bench of legislators who actually know about mental health, support it. And to me, that's one of the most important things, is to actually grow that political capacity to support mental health. There are incredibly strong community partners, and often not from the traditional mental health sector, but folks working in the healthcare sector, youth rights, et cetera. State agency support, youth and family voice, that was incredibly important in passing some of this legislation. And there was also an EPSDT lawsuit, and the settlement of that also is creating some momentum for change. So when I think about all this, it gives me really some hope that in our states there's an opportunity to continue the change. And I do want to leave you with some words that really, I think, help people create that momentum in their states. And it's really follow the money, leverage the law, and empower the people. So I only have a couple minutes left, so I won't go into these. But when I first heard this phrase, it actually made me cry, because I thought, oh my gosh, how do I do that? But once you learn to find the money, to follow it, when you leverage existing regulations and statutes, federal laws, court decisions, when you give voice to people, you can enact real change. And that is what we all need to remember. And I love this quote from the founder of Inseparable, because really it is up to all of us to be bold and take those risks, because if we don't do that, who will? And with that, I want to thank you for listening and being here today. And we do love to partner, so please reach out. We need partners in states, particularly the Intermountain states, and would be delighted to help all of us work collectively to help the future of our country. Thank you.